Okay, perfect. So I think we'll make a start there. So yeah, big welcome to everybody who's joined the call. Thanks for taking some time out of your day to join us on this webinar. So we're going to be covering managing operational pressures in general practice using Ardens Manager today on this call. My name's James Brown. I'm the commercial manager for the Ardens Manager side of what we do at Ardens here. And I've also got my colleague Mariette with me today. She's one of our great training specialists who's going to be taking us through a live demonstration of some of this functionality a little bit later on the call. So just to start off with, I'm just going to sort of run through just some brief housekeeping for how we tend to run these webinars. This is set up as a registered event, so by default, everybody's camera and microphone will be disabled, but you can ask questions via the Q&A section. So up at the top of your Teams window, you should see an option next to chat that's labeled Q&A. So I'd encourage you throughout the session, if you've got any questions at all, just drop them in there. I've got some colleagues on the call that'll be able to jump in and answer those questions, but we'll make sure that we address them certainly by the end of the webinar, and anything that we can't answer directly, we'll follow up with you afterwards as well. Just going to be a short call this afternoon. So duration of the webinars just scheduled for 30 minutes. And we are recording the session, which we'll be able to then send out to everybody afterwards to refer back to or share with your colleagues as well. And if you do experience any audio issues sort of during the call, tend to occasionally have those sorts of issues happening, but usually just a disconnect and a reconnect. So rejoining the call usually just irons those out and sorts them out. And of course, you'll have the recording as well to refer back to if you do miss out on just any small section of it. Perfect. So what we'll cover in the session this afternoon then is what OPEL means for practices, what good pressure monitoring looks like. We'll then go through a working demonstration of how the tools actually work and behave within Ardens Manager itself. And then finally go through how you can get enabled to use this functionality locally across your group or across your patch. So that's the sort of the structure of the webinar and what we'll be covering this afternoon. So I'd like to start really just with a question to everybody. So how are you reporting pressure today? What we're going to try and do is just get a poll sent out to everybody. So you should see some options pop up very shortly. But we'd be really interested to know how you're reporting pressure today, whether you don't report it at all, you don't have a system in place to do that locally across your system, whether you're reporting it via something like an Excel sheet or a manual template that's given to you by your system. There might be a local tool like an LMC tool or form, or just anything else. So yeah, just interested to hear from everybody as to how everybody's managing that currently.
We've got a mixture, James, between we don't report it, LMC tool, and something else.
Perfect. Thanks, Charmaine. Yeah, great. So really interesting to see that. So yeah, a few responses coming in, and yeah, really as we're hearing across our customer base across the country that there's a big mix with this, that some are just not reporting pressure levels at all. There's just no system for it within their region. Others, we know that there are some existing systems in place, and also we're aware that in some areas there is quite a manual process as well, which can be quite frustrating at times. So the problem that we're really trying to address with this functionality within Ardens Manager is a few of these here. So pressure is often felt, it is felt daily by practices. So this changes quite and can change quite quickly. So it's certainly felt daily. The reporting mechanisms are often manual, and they can be quite subjective as well, where there's no sort of data behind it or automatic calculation. It's just a subjective kind of feeling as to what pressure level that an organisation might be at. And where that is the case as well, comparing pressure can be quite inconsistent, because a lot of it can be subjective. Comparing it against other organisations within the area to get a true kind of pressure level across the system can be quite inconsistent. And that therefore support could be quite reactive rather than proactive, not managing this effectively, that we can't sort of spot trends and proactively put support in place to avoid pressure escalating. So the support is often quite reactive in that sense. So what is OPEL then? So OPEL stands for Operational Pressures Escalation Levels, and it's a way of reporting a score for pressure across your practice, and that can then be looked at across the system. So the pressure scores range from green to black. So where we're reporting a pressure score, green would indicate no problems at all, just normal operations, the system can meet demand, or your practice can meet the demands of your patients. That then moves to amber, where there's a moderate pressure felt, and that would sort of be explained as actions would be needed to maintain usual patient flow. Up to red being quite a severe level, and that's where major actions and support from other organisations could be required, and then all the way up to black, which is classed as extreme, where we might be feeling that we're unable to deliver care, requiring some regional or national intervention. And the purpose for it really is to identify those pressures as early as possible. We can escalate that there's pressure felt appropriately to our system for support. And effectively, the overall purpose is to protect patient safety and staff well-being across services. What it's absolutely not, though, it's not a performance management tool, and it's not about managing better as you are as an individual organisation. It's about a shared mechanism to flag where support might be needed from the system to improve that pressure level. So what does good pressure monitoring look like then? So certainly less admin. So if we can put a system in place around this to help us to calculate those scores and to escalate where appropriate, that's going to lead to less admin. We don't have to fill in spreadsheets or sending manual emails, and certainly more automation. Good pressure monitoring looks like a data-driven approach, so using evidence to calculate those pressure level or pressure scores. And certainly it looks like early support via pressure trends as well. So how does it work in Ardens Manager? So I'm going to take you through a bit of a pathway as to how the functionality works within the system, and then we'll look at a live demonstration as to how it behaves in the platform itself. So it really starts with the monitoring. So with Ardens Manager, it's the National Content Dashboards package is quite a well-rounded dashboards package, and within that you've got dashboards to monitor appointment activity. So you can monitor that data from appointment demand, for your workload and capacity through those appointments dashboards. Now, with that data, you can do a couple of things by calculating a pressure score to be submitted up to your group level or system level. The first method of doing that is through a calculated pressure calculation. So this is a data-driven equation that's based on demand metrics, workload and capacity, and we put all of that into a scoring system that will automatically calculate a score and then therefore suggest a pressure level from green, amber, red or black. And some of the options on the screen here, so from appointment demand, appointment utilization rate, appointment wait times, appointment DNA rate, consultation rate and appointment availability, those are some of the metrics that are used to then calculate that score. So there's data behind this really, it's all data driven. What the system then also factors in is a manual pressure assessment. So as a practice, you can see what that calculation is and what that suggested pressure level is, for sort of a better way of explaining it, that suggested level. But then some other pressures may come from outside, which would mean that a practice can make a decision to upgrade that pressure level, for example. That can just be factors outside of sort of any data that's available, staff sickness, things like that. So you can open up a manual dialog box here, and you can set a pressure level for submission back up to the system. And in that form, you're submitting an OPEL status. You can also put some detail in there around the reasons, and you can also upload evidence as well. So as well as that calculated score, you can also upload any sort of anecdotal evidence, but also attachments as well, files. And what the system also does for individual practices is it will send an email reminder to you to report that pressure level as well. So where this is a system approach and we're doing this regularly, you'll get an email reminder from the software just to remind you to log in and submit that pressure level. The next stage then becomes how that's then escalated up to the system. So this could be a group administrator, this could be a federation, a PCN, but where this works really well is with a system-wide commissioning agreement. So if the ICB chooses to roll Ardens Manager out across a patch, this works really well, where the pressure levels can be submitted up to that system level. Now, all of those escalation reports gathered from practices are submitted up to that group level, and the system or the group administrator will get an email notification when escalation is required or escalation levels have been sent up that require approval. They can put approval mechanisms in place, communicate with the practices about that pressure level, and review any of those manual submissions against that calculated pressure level as well, and ultimately just use that information to communicate with the practices to work out where support or intervention might be required. Next stage is then coordinating with the practice. So as I mentioned, communicate with the practice about what's contributing to that pressure level. What's nice about this system as well is that you can look back over time. So you can look at what happened last time, review any previous pressure levels around sort of similar times of the year, for example, review those previous submissions and actions that were put in place to maybe to help to reduce that pressure level. And you can review that all over time as well. So as a complete system, the system can review those pressure trends by individual practice, as an ICB or as a group as a whole, and use all of that information to predict where pressure may increase at certain points in the year, and ultimately put those measures in place to learn from that, what's happened previously, and prevent pressures escalating at similar points in the year over time. So that's sort of the pathway really as to how the functionality is designed to work within the system. Now I'm going to pass over to Mariette, who's just going to take you through some live demonstration. Are you there, Mariette?
Thank you, James, and good afternoon, everybody. So on to our live demonstration for the afternoon. So bearing in mind all those things that James has just shown you, let's take a look at how that looks from a live perspective. So we're going to start off looking at it from a practice perspective, and then we're going to move on to what it looks like at group level. So first things first is accessing your OPEL dashboard. Just along the left-hand side here, you would go to the OPEL module here and just click on your OPEL pressure monitoring. So I'm using this in a demo site at the moment. So we're logged in as Garden View Medical, which has got all dummy data in. But from a practice perspective, we can then see first up in this top section what our current status is. That is based on submitted status, so those manual entries that you're submitting, or you've got your calculated status here, which the system will automatically calculate for you. Now, with the calculated status, that is updated on a weekly basis, and a lot of things can happen in a week. So if you do have any factors that contribute to being not that status there, you can then manually update it just by clicking on the current status there and updating it. You can do this once a day. We can then go through this box here to submit whatever our updated status is. So you can tick the boxes here to indicate what status you are. If you tick the green box, just submit some evidence and click submit. But for all the other statuses, you'll see a separate section pops out so that you can record what the nature of the status update is. So is it weather related, perhaps an IT outage, maybe just staffing levels or patient demand. But tick the boxes that apply. You can even add in an expected end date. So if you've got staff on long-term sickness, or perhaps your IT outage might take a couple of days to fix, you can then add a date in there as well. Once you're ready, click the submit button, and that will then be escalated through to your group lead. You've also got this option to view your history as well. So you may want to look back over time just to see what the different statuses were and what submission status they are in. So from my list here, I can see that I've got a status awaiting approval. I've got some in draft that I haven't finished from a while ago, but I can also see where it was rejected or perhaps challenged back to my group lead. As we come down the dashboard, you've got the standard benchmarking tool here that for those of you who do use Ardens Manager regularly, you'll be familiar with the benchmarking tool. But this one shows you what that looks like across your data sharing groups there. So for my Garden View Medical, I can see my current submitted status is red, but my calculated status is amber. You've also got the option to quickly view what that looks like. So what did I submit? And then for my calculated status, I can see what the calculation is based on. So from here, we can see I'm amber. Hover over the information icons, and that will then confirm for you what the scoring thresholds are. As we come down, here are these reports that James mentioned, where we are calculating those scores for you based on data. And again, all these information icons will explain to you how we've come to those certain criteria. And then you've got the total points at the bottom there. So it's a good overview to have a look at what that is. And you can use these view buttons for the other practices within your PCN or data sharing group there to see what their details are. And then you've got your trend chart over on the right hand side where you'll be able to review what your trends are doing over time. Now, from a group level perspective, if I just switch to a group level dashboard, when you log into your group, you will then see exactly the same screen, but this time with a little bit more information available for all those different practices. So from here in the top, again, we can see the difference between our submitted status as well as calculated status, and this will be displayed in the form of percentage. So what percentage all of your practices are for each one of those different statuses. You've got the option here to view all of your submissions outstanding. So for any of those manual submissions that are coming in, you've then got quick access to see what the statuses are so that you can go and review those elements. If we were going to review this one at the top here, so for Evergreen, click on that review button. I can then read what the practice has submitted. If I'm happy with that, I can click approve, and that will then override their submitted status to be this one. If, however, I don't agree with this, in the comments field here, you can type a message back to the practice for some context or perhaps to ask a question, and then click that reject button there. That will then go back to that practice, as we've seen on the practice view there, to say that it has been rejected, and the practice can then resubmit that status or challenge it with further information. As we move down the screen, you've got your benchmarking tool here. So exactly the same as practice view, you can then see the individual details at a quick glance for each one of those different practices on your list. You can also filter your dashboard. So you can filter by submitted status or calculated status. So if I wanted to see just my practices who are listed as a red calculated status, click apply, and that will then show me those two practices there. Moving over to monitoring all of these trends and getting to the point where we're trying to predict what might be happening. Using this trend chart, we can see here that it's picking up on all the different status categories. And the first drop-down menu, I can pick the time period that I want to measure. So I'm currently on current quarter, but if I wanted to view that over the past 12 months, I can then select that from there, and it will start to populate what the data is looking like. You've even got monthly data, so if you're just looking at it from a monthly perspective, you've got some various different options there. Just next to that, you've got a compare field, so it allows you to compare the time frame to a previous time frame. So you've either got the previous time frame, which is linked to this first selection here. So if we're on current quarter, we'll then be looking at the previous quarter in comparison, or you've got compare it to the previous year. But if I just pick the previous time frame, you'll see the previous time frame now has dotted lines on the chart. So this is where it's quite handy to be able to start predicting how these things might affect your pressure levels going forward. Just another little feature here on the chart, you have got the option of viewing the chart data based on the manual submissions, or if you toggle that one, it will give you the calculated data as well. So it's really flexible. And then from a group level perspective, you've got the option of viewing this as a line chart or just using the heat map here, you can view it in terms of a heat map or a stacked bar chart. So it gives you lots of different fields to be able to view the data in a way that suits you. The system will automatically generate tasks. So as well as being able to manually update the data on the dashboards, you'll see that it sends out tasks on a daily basis. So from a practice perspective, every day you'll get a task allowing you to update your status manually if you wish to do so. And from a group level perspective, you'll have a task asking you to approve a status as soon as there's a new status that has been submitted by the practice. We also send out emails. And if I just pop into the account settings here, for my Garden View medical practice, you'll see on the main details page, you've got the OPEL notification settings on here. It does give you the option to send your OPEL notification emails to all of your system admins, or you can choose to send it to specific users or just turn them off altogether. The choice really is yours. And then from a group perspective, we can see here that it's set up for my group as sending it to specific users, and you can have as many as you want on there, but that allows you to add those users onto there. And that is a whistle-stop tour of the live OPEL environment, so I'm going to hand you back to James.
Perfect. Thank you very much, Mariette. Thanks. Yeah, so I think I'd like to just summarize with some of the key benefits really across kind of all layers within the organization structures. Big thanks for some of the questions that we've had so far as well. So from Victoria and Lisa, sort of around how can they access it, can use it as an individual practice. So I'll cover off some of that now as well. But OPEL is available as part of the Ardens Manager National Content Dashboards package. So for those of you that are already subscribing to that, there's no additional cost or anything. We just need to get you enabled and set up on there. But you do really need to be part of a group, so such as a PCN, Federation, Alliance, or ideally, you know, an ICB. This works really well over kind of complete system approach. But certainly if you're part of a group, we can get that switched on for you so you can start to use it. If you're not part of a group already, we can certainly support you with a free trial. So it's something that's always available. More than happy to speak to any of you that are interested about that sort of separately, and I'll share some details of how you can do that shortly. But really, just to summarize on some of the benefits, there are benefits across all of the organization levels, if you like. So from a GP practice, this is really designed to, you know, completely cut admin, just a really robust way of reporting it and calculating it. So cutting that admin time, allowing you to give credible evidence to support that escalation level, allowing you to support better and safer decision making, and essentially strengthening the escalation conversations as well with your system with that evidence. Across PCNs and federations, allows you to view a single consistent view across all of your practices. Your support is then allocated, you know, fairly. It can improve deployment of resources such as your ARRS and rotas as well. So where you've got combined resource across your PCN, your federation, you can accurately decide where to deploy that to have the maximum benefit. And it enables that trend-based planning at scale as well. And certainly from an ICB or place point of view, so sort of commissioner point of view, those benefits include data-driven system oversight, comparable data, so you can look at that over time as well, proactive interventions, can reduce that reporting burden and essentially make sure that you've got governance and assurance wrapped around this sort of process. Now, in order to get started as well, if you're already a national content dashboards subscriber, you can email in to support@ardens.org.uk, and then we can look at your particular configuration and just make sure that we can get you configured and set up. So feel free to email in at that email address. If you're not an Ardens Manager subscriber or a National Content Dashboard subscriber, we can set up a further follow-up meeting with a team member from Ardens just to explore what's included, have a look at your specific scenario and what's needed, and we can support you with a free 1-month trial for individual practice, but also for groups as well. We'll follow up with you all shortly after the webinar with those instructions as to how you can get that further support and how you can get started, as well as a recording of the session as well, which you can refer back to, and please feel free to share that with colleagues as well. And then just leave you with a couple of bits here. Additional training and support is kind of core of what we always offer at Ardens. There's no cap or limit to the amount of training and support that you can request from us. And that goes for this, but also all services that we offer. So feel free to scan that QR code, and that will take you to a page full of all of our support resources, from Ardens Academy to support articles, and how you can access that additional training as well. And then I'm just going to move on to one more. So just leave that up there so you can scan that if you need to. And then over just to the final one, we really value all of your feedback on the sessions like this that we put out. So if any of you are happy just to take a little bit of time, scan that QR code. We'd love to hear from you just with a bit of feedback on the session, of any suggestions for improvements or what you found useful or not. So we'd love to hear from you then. And that sort of brings us to the end of the session, really. So I'm going to hang on just for a few seconds or a few minutes, just in case we get any more questions dropped into the Q&A. But otherwise, like I say, we will follow up with everybody with that recording and instructions for how to get started. And any additional questions that you think of afterwards, just feel free to reach out. And thanks again for your time and for joining us this afternoon.